Hello, everyone. My name is Gilda Rubira Gutierrez. I am in my last year of physiotherapy at the University Catholic Santiago of Guayaquil. I would like to share with you my technical English project, which is titled The Effect of Hip and Hamstring Pathology on Sacroiliac Joint Dysfunction. The sacroiliac joint is a term used to describe the place where the sacrum and the iliac bones meet. The sacrum is located at the base of the spine. It is made up of 5 vertebrae or backbones that are fused together. The iliac bones are the 2 large bones that make up the pelvis, and the sacrum is located in the middle of the iliac bones. I'm sorry, wait a minute. Well, what is sacroiliac joint dysfunction? The sacroiliac joint dysfunction is one of the multiple etiologies of lower back pain, being the 15 than 30% of back pain, which brings change in the quality and style of living due to pain and disability. These revisions give us a description of the anatomy involved clinical presentation, physical examination, with orientation to the diagnosis. Diagnostic maneuvers used are with the possibility of using a specific and adequate treatment of this entity, which it is already under diagnosis. All done with the aim for giving an instruments to physicians interest in well-being of the patient.
Dr. Casey Crisp with the Rising Rehab Centers, and today we're going to talk about a condition called SI joint pain. We're going to talk about the causes of SI joint pain. We're going to talk about the signs and symptoms of this condition. We're also going to talk about the traditional health care management of SI joint pain and how Rosty is a little different. So let's get started. Okay, so what is SI joint pain? Well, let's talk about what SI joint is first. The SI joint is a connection between your sacrum and your ilium. Your sacrum is your tailbone, and the ilium is where you can put your hands on your hips, okay? What happens is this connection between those two bones can be injured through overuse, through running, lifting, walking, and or sitting for long periods of time. So let's talk about the signs and symptoms of SI joint pain. Now, SI joint pain is kind of a weird condition. One of the big signs that people tell us about is that if they sit for long periods of time, they'll get pain in their back, okay? So what do? They get up, they go for a walk, it starts to feel better for a little bit, but then the pain starts to come back. So then what do? You sit back down, and it actually feels better for a little bit, and then it comes back. Now, another sign and symptom is if you find yourself sleeping on one side, due to if you lay on the other side your back hurts, that may be a sign of SI joint pain. Now let's talk about how traditional healthcare usually manages SI joint pain. They sometimes may suggest rest or decreasing your activity, heat or ice to the joint to help with any inflammation, pain medication to help, of course, help with your pain. Sometimes joint injections to help get inflammation out of the joint, and then in worst case scenarios, possibly surgery to help fuse the joint. Okay, so let's talk about how Rossi is a little different. At Arasti, you're going to spend a full hour with us. Now, during that hour, we're going to do a detailed history exam, and at the end of that, we're actually going to arrive at an accurate diagnosis. But then, we're actually going to explain to you what that diagnosis means. Then after that, we're going to do active manual therapy to your affected area. Then, we're going to actually teach and show you exercises that you can do at home to help you keep improving. We hope this information presented was helpful to you. Now, if you or anyone in your family is suffering from SI joint pain, please
Well, application in physiotherapy. Treatment for sacroiliac joint dysfunction are generally conservative and focus on restoring normal mobility to the joint. Typical treatments for sacroiliac joint dysfunctions included eyes, head, and rest. There are no prospective studies that assess the effect of physiotherapy, aerobics exercise, stabilization exercise, or restoration of range of motion in sacroiliac joint syndrome. Without, however, exercise is an important aspect in the treatment of this syndrome. At the same time as stabilization, although empirical. The strategy that physical therapy provides are emphasis in pelvic stabilization, restorations, postural and dynamic caused by muscle weakness, which cause gait abnormalities. Several authors have described muscular imbalance in patients with dysfunction of the sacroiliac joint. This weakness stems from the trunk to the lower extremity to the muscles that strengthen or relax the sacroiliac joint. Wait a minute, please.
It's interesting because often people will come in with MRIs that show disc herniation, disc protrusion, degenerated discs, and some people don't even know what the sacroiliac joint is, and it's like a humongous joint. Think about when people injure their lower back, they almost always injure it when they bend and they twist to the side. They bend and they twist to the side. Well, when you bend and you twist to the side, so this is a model of the lower back, this is the iliac crest, this is the sacrum, this is the L5-S1 joint, then this joint right here, see how humongous this is? That's the sacroiliac joint, sacro for sacrum, iliac, and look at this mesh of ligaments. And I'm telling you, almost every single person who comes to the office here, they're gonna say that, doc, my pain's on the side here. Very seldom do people say, oh, it's like right in the middle here. Usually it's on this side or it's on this side. So basically where they're pointing to is the sacroiliac joint. The number one treatment to resolve chronic sacroiliac pain is prolotherapy, because prolotherapy is the treatment of choice to tighten a ligament. The sacroiliac joint is supported by ligaments. So when a person gets comprehensive prolotherapy, it's a shot there, shot there, shot there. It's like spot welding to get this really strong. And people around don't realize that beside low back pain, when you have sacroiliac dysfunction or injury to your sacroiliac joint, that can refer pain down the leg. So much more common than sciatica or a sciatic nerve problem is actually leg pain from sacroiliac injury. And sacroiliac pain is very successfully treated with comprehensive prolotherapy. You don't need surgery. You don't need other treatments. Normally after 3, 4, 5 visits, it's completely resolved and it stays resolved.
Well, pros and cons. Pros, long-term pain in the sacroiliac joint may cause an imbalance in the muscles or stiffness in the surrounding joints that may affect the patient's balance. The therapist may develop a program to address the underlying cause of this balance training exercise. Comes, sacroiliac joint dysfunctions is a condition that is made be misdiagnosed as herniated disc, so it is important to be aware of the specific symptoms associated with sacroiliac joint pain.
My name is Dr. Steve Gogella. I am a neurosurgeon with neurological and spinal surgery here in Lincoln, Nebraska, and I've been in practice there since July of 2017. And today I'd like to talk in particular about a minimally invasive approach to sacroiliac pain and sacroiliac joint fusions. The sacroiliac joint, or SI joint, is the intersection between your spine and your pelvis. All weight as you walk is transmitted from your spine into your pelvis through these joints on each side. So sacroiliitis, or SI joint pain, can mimic a lot of other conditions. Typically, patients have pain in their lower back, below their belt line, at their lower back or upper buttocks. This can radiate around their hips or down the back of their legs, typically not past the knees. Approximately 20% of patients that are suffering from back pain are actually suffering from sacroiliac joint pain. The causes are several, but oftentimes it's a degenerative joint in an elderly patient. Sometimes it's caused by trauma, especially trauma when somebody falls on their buttocks. We typically try to treat them with dedicated SI joint physical therapy for a period of several weeks, and often will trial an injection into that joint to ensure that that is where their pain is being generated. In a patient who clearly has sacroiliac pain and has a positive SI joint block, has not responded to physical therapy, there is a significant amount of evidence that that particular patient could benefit from a sacroiliac joint fusion. So if you fail conservative management and we've decided to go forward with surgery to treat your SI joint pain, the iFuse procedure is a relatively quick procedure. It's minimally invasive. There's typically a less than 3 centimeter incision. There's limited tissue trauma because it's done completely with X-ray guidance in the operating room. Patients typically do very well with these procedures and oftentimes have significant reduction or elimination of their pain within several weeks or sometimes right away. So if you're a patient who's suffering from significant low back pain and think that the SI joint may be your problem, feel free to give us a call or visit our website, and we'd be happy to see you and evaluate whether or not you may benefit from one of these SI joint procedures.
In Ecuador, sacroiliac dysfunctions can cause many effects in the proximal joints, or the ones that are most commonly affect signs. These dysfunctions cause low back pain, which has a rate of approximately 18% in the Ecuador. Well, finally, the conclusions. The dysfunction of the sacroiliac joint is one of the cause of these symptoms. And in recent years, they have published papers showing that his prevalence is higher than previously thought above. 10 than 30% of cases of pain lumbar depending on this series.
I'm Dr. Arend of the Mayfield Clinic here in Cincinnati, and one condition that has come to a little more prominence, I think, in terms of understanding of the patients and that I see in my practice that can sometimes be a cause of low back pain is sacroiliac dysfunction. Now, clearly, lots of people have low back pain that's disabling at some point in their life. In fact, a lot of statistics would say that's almost 75 or 80% of the people in the country will have at least one episode of severe back pain during their lifetime. And it's not always the spine itself that causes that back pain. And so what we have begun to recognize, certainly to a much greater extent in the last few years than we had previously, is that sometimes that back or hip or leg pain can actually be coming from the sacroiliac joint, which is not technically part of the spine. It's actually the junction of the spine with the pelvis. So the joint is very important in our everyday life because it's sort of the fulcrum between, and it facilitates the transfer of weight from our spine through our pelvis to our legs. And what we've begun to realize is that a lot of people who previously were told you have back pain that we just can't fix actually may have a cause of back pain that's imminently fixable, and that pain generator may not be their spine or their disc or their muscles even, but perhaps is their sacroiliac joint.
Well, this was all I can contribute about my topic. And I am very grateful for having come this far and having listening to me. Thanks. Thank you so much. And have a nice day. Bye.